Thanks for joining us. I understand that you all were in Washington today on Capitol Hill with a number of doctors visiting with congressmen, talking about this issue of health care reform.
Absolutely. We had hundreds of doctors and folks out for a rally who wanted to make it clear that they aren't on board with this.
Now, how many doctors, Mark, did you have here in town?
At our rally, I believe we had between 500 and 600, which is pretty remarkable because physicians, they don't like to go anywhere.
No, I guess not. They probably like to be home.
Taking care of patients.
Yeah, after you work very long hours looking after your patients, so it's hard to do a lot of other things because your family already suffers and misses you, and leaving for other things can be quite a challenge sometimes.
Now, give us your thought here. Last night the president, some of the president's advisors, when they were talking after his speech, made the comment that, hey, the doctors are on board with this. The doctors are supportive of this. They see this as a good thing. Now, I have to be honest. I have not met a doctor that's told me they're on board with this. But are doctors lining up to support this plan?
Not in my neighborhood.
And doctors just lined up at the Capitol to oppose it. The only organizations, if you listen to organized medicine, then you would believe that doctors support it. The AMA has come out in support of it. And what's happened is that the AMA has lost thousands of members over the last couple months since they came out supporting H.R. 3200. And the AMA really, the membership of the AMA is not a majority of the doctors in the country anyway. So no, people, and actually I think it's a really important point to make because the public has been confused. They hear that doctors are supporting it and they think, what's wrong with me? What am I not getting? If the doctors are in favor of it, then I must be missing something. But no, doctors, there are serious concerns over the rationing. The physicians' hands would be tied by the Comparable Effectiveness Research Council, and that council has already been appointed. There's not a single doctor on it. Mr. Smith mentioned the NICE agency in UK.
Right.
That would be our comparable thing to the NICE agency. There's not a doctor on it.
Well, Dr. Kellen, tell me, as a physician, what is your major concern over what you're hearing from the president and what you're reading in the actual legislation? I think there needs to be a distinction. What the president says is one thing. What's actually in the bill is really what we should keep our eyes on.
One concern is that it's government-centered, and what we need is a patient-centered system. Yeah, I make the point, people talk about health care reform and how we need it, and I make the point, we don't need health care reform. We need government reform. Because virtually every problem we have with cost and access transfers over to some government rule or regulation set in to protect some large interest.
Well, let me ask you about that, because the president last night said that there would be no increase in the debt to do this almost $1 trillion plan. Did not talk about tax increases, talked about it would be funded through cuts in existing programs. Now, he said waste, but I think what it is reimbursement payments to doctors and other medical facilities that provide services. I've talked to a number of doctors, in fact, my own doctor, and he's concerned about just what he has seen in Medicaid, where the government continues to squeeze doctors, and they're spending less and less time with their patients. I mean, is that a problem that you see in a plan such as this?
What it does is it creates more bureaucracies, more rules, more regulations. Part of my practice is pain management, and if a simple patient visit will generate 10 sheets of paper. If we actually have to do something more, we can generate 18 to 20 sheets of paper for a single visit for one person. And what you end up with is you spend more time treating the government or the insurance company rather than the patient.
I can support that with the numbers. Doctors have reported, according to our surveys, doctors and their staff spend 25% of their time on Medicare compliance. That's not treating patients, that's compliance alone. So do we really expect that further government interference is going to make that better or worse? Let's get real about that. We also know that it takes 50% longer just to fill out a government insurance claim compared to a private insurance claim. So we are eating away at patient time with government regulations. If government would get out of the way, doctors who have eliminated government contracts and insurance contracts from their practices can lower their rates down to charge $35 office visit. That's what a lot of people pay for co-pays. So once we get the government out of the way, the patients then can take over and the prices actually come down for physicians. And the problem with doctors is I don't know how much lower the reimbursement rates can go. In some cases, some parts of the country, doctors are paid as little as $12 or $13 for a Medicare patient visit. Now, I don't know about you, but I pay my plumber more than that for a 10 or 15-minute visit.
Well, I think I'd rather pay my doctor a little more than my plumber. Let me ask you a question, because this is an important question to me, and I've run into a couple of pre-med students that have expressed concern about this because they're watching it. They're concerned about the conscience rights and protections that may be gone in this bill. As a doctor, I mean, if all of a sudden you find your hands tied by the federal government to engage in certain practices that you find objectionable and immoral, I mean, what's the choices that you have? I mean, do you get out of health care at that time?
If your morality is such that it can be altered in that manner, then maybe you should leave in the first place. But that really is the issue, is you take an honored profession of men and women who went into this because they're some of the most altruistic people in the nation. We truly care about people. We cry with them and suffer with them when things aren't right. And what that does is take that learned profession of honor and decency and turns it into a skilled government worker. That's all. And that's not in the patient's best interest, because what you want is the physician to be your advocate, not the dispenser of whatever the government regimen is for the month. Right.
When the Association of American Physicians and Surgeons joined in the lawsuit regarding the freedom of conscience rules with Family Research Council, we heard from doctors across the country. And I was kind of surprised to hear the president stand up and say last night that the freedom of conscience protections would be in place. I'd sure like to know if they've backed down and he doesn't know it, or if there's been a real change here, because it doesn't. That's not what they've been going.
They remained really teethless.
That's right.
And so I think healthcare workers remain unprotected.
That's right.
Well, Dr. Kellen, Kathryn, thank you for joining us.
Thank you.
Appreciate your work, and thanks for bringing all those doctors to Capitol Hill.
Thank you.
Gotta fight.
We can always use a second opinion up here.
Thank you.
All right, thanks.